Every 40 seconds, someone in the world suffers a stroke. It happens in the blink of an eye. But would you recognize the signs in time? Could you save a life? Today, we talk about the silent emergency. Stroke doesn't discriminate. It can happen to anyone, anywhere. It is a leading cause of disability worldwide. Understanding a stroke isn't just medical knowledge, it's a life-saving tool that everyone needs to have. Simply put, a stroke is a brain attack. It occurs when the blood supply to part of your brain is cut off. Think of it like a roadblock on a highway. When the blood can't get through, brain cells start to die. Every minute counts. Your brain loses nearly 2 million cells for every minute blood flow is interrupted. There are 3 main types of stroke you should know about, and each one is a serious medical emergency. First, the ischemic stroke. This is the most common type, caused by a blood clot blocking an artery. Second is the hemorrhagic stroke. This happens when a blood vessel leaks or bursts, putting pressure on brain cells. Third is the TIA, or mini stroke. This is a temporary blockage that usually lasts only a few minutes. Don't be fooled because the symptoms go away. A TIA is often a warning that a major stroke is coming. The most important thing you can learn today is the FACE-T method. Let's break it down together. F stands for face. Ask the person to smile. Does one side of the face droop or feel numb? A stands for arm. Ask them to raise both arms. Does one arm drift downward? Is it weak or numb? S is for speech. Is their speech slurred? Ask them to repeat a simple sentence like, "The sky is blue." T is for time. If you see any of these signs, even if they go away, call emergency services immediately. Take note of the exact time when the symptoms first appeared. This is vital information for the doctors. Beyond fast, watch for sudden confusion, a severe headache with no known cause, or sudden dizziness. Sudden trouble seeing in one or both eyes, or trouble walking and loss of balance are also key warning signs. Let's repeat it. Face, arm, speech, and time. Memorize this. It could be the difference between life and death. Let's look at a real-life scenario. Imagine you're at lunch with a friend and they suddenly drop their fork. They look confused. You ask them if they're okay, but their reply is slurred and hard to understand. Because you know the signs, you don't wait. You immediately call for help and tell them it might be a stroke. The paramedics arrive within minutes. Because you acted fast, your friend is rushed to the hospital in time. At the hospital, they receive treatment to dissolve the clot. A few days later, they are back on their feet. That's the power of recognition. You saved a life by knowing what to look for and acting without hesitation. Now, why do strokes happen? While some factors are out of our control, many are within our power to change. High blood pressure is the leading cause of stroke. It puts constant stress on your artery walls over time. Smoking doubles your risk. It damages your blood vessels and makes your blood more likely to clot. Diabetes and obesity also play huge roles. They contribute to the buildup of fatty deposits in your arteries. Chronic stress and a sedentary lifestyle further increase the pressure on your cardiovascular system. If you suspect someone is having a stroke, there is only one first step. Call emergency services immediately. Never wait to see if the symptoms go away. Even if they stop, the brain damage might already be happening. Do not give the person aspirin or any medication. Some strokes are caused by bleeding, and aspirin can make it worse. Keep them calm. Have them lie down on their side with their head slightly raised while you wait for help. The good news is that up to 80% of strokes are preventable through simple lifestyle changes. Start with what you eat. A diet rich in fruits, vegetables, and whole grains lowers your blood pressure. Reducing your salt intake and avoiding processed fats can significantly protect your arteries from damage. Get moving. Aim for at least 30 minutes of moderate exercise 5 days a week. Walking is perfect. If you smoke, please quit. Your stroke risk begins to drop almost immediately after your last cigarette. See your doctor regularly. Managing high blood pressure and cholesterol is the best defense you have. Manage your stress. Find time for relaxation, deep breathing, or hobbies that make you feel at peace. Stroke is terrifying, but it doesn't have to be a tragedy. Knowledge is your most powerful weapon. By learning the signs and acting fast, you can ensure that your loved ones have a future. Please share this video. You never know whose life you might be saving just by passing on this info. Thank you for watching. Stay safe, stay healthy, and remember, every second counts.